Hi, this is Becky from More Than Borderline, and today I'm going to talk about bed space in hospitals. Recently, the city of Indianapolis and some private donors gave money to the public hospital here in town to build a new facility. Well, unfortunately, when the new facility was built, psychiatric care was kind of an afterthought. There are fewer beds than there were at the old facility, and at the old facility, they ran at a 98% occupation rate for psychiatric care. Now, isn't that a little irresponsible to cut the number of beds available, especially the number of beds available for emergency psychiatric care for poor people? Well, it is if you ran a hospital based on charity, which a public hospital is supposed to do. And some private hospitals were established as charity hospitals. Sadly, psychiatric care is among the most expensive and least profitable fields of medicine. So, psychiatric care is not always high on the list of priorities for hospitals. And that's really a tragedy, because 1 out of every 4 Americans will have some form of mental illness at some point in their lives. Now, you'd think we'd be sophisticated enough in our society to have adequate funding for mental health, but that's not always the case. So what can we do? We can demand change from elected officials. We can demand change from hospitals. We can demand change and demand more spending on mental health. Now, unfortunately, this comes at the cost of either higher premiums insurance-wise or higher taxes. We've got to ask ourselves, what are we willing to pay to ensure there's an adequate safety net available? Sometimes doing the right thing is going to cost a little more. Nobody likes to think that way, but it's true. So, we've got to be willing to take care of each other. We've got to be willing to have adequate psychiatric care available. If we didn't have adequate cardiac care available, there'd be a huge public outcry. And we need the same thing for psychiatric care. We need to be outraged. We need to push for change. Anyway, what are your thoughts on it? Do you know of any inadequate psychiatric care in your situation? Feel free to post in the comments. I look forward to discussing this with you guys. This is Becky from More Than Borderline signing off.